Have Vortioxetine, complete drug monograph. 1. Basic information. Generic name Vortioxetine. Pronunciation Vortioxetine. Drug class antidepressant, serotonin modulator and stimulator. Brand name Trintellix, United States, Canada, EU. Trintellix, former brand name in some regions. Available forms and strengths. Oral tablets 5 milligrams, 10 milligrams, 15 milligrams, 20 milligrams. Route of administration oral. Pregnancy category, Category C, use only if potential benefit outweighs risk. Controlled substance, not controlled. Definition: Vortioxetine is an antidepressant medication primarily used for the treatment of major depressive disorder, MDD, in adults. It belongs to a unique class of antidepressants known as serotonin modulators and stimulators acting on multiple serotonin 5-HT receptor subtypes and the serotonin transporter. This multimodal mechanism enhances both serotonergic transmission and cognitive function, improving symptoms of depression, mood, energy, and mental clarity. Number 3. Mechanism of action. Vortioxetine has a multimodal mechanism that affects serotonin receptors in addition to blocking serotonin reuptake. Target, effect. Serotonin transporter SERT inhibition. Serotonin availability in synaptic cleft 5-HTA receptor, full agonist, enhances mood and anxiolytic effects. 5-HTB receptor, partial agonist, modulates mood and dopamine release. 5-HT3, 5-HTD, 5-HT receptors, antagonist, improves cognition, reduces anxiety and nausea. Net effect, increases serotonergic, dopaminergic, and noradrenergic neurotransmission indirectly, improves mood, anxiety, and cognitive processing. 4. Therapeutic uses, approved use, major depressive disorder, MDD, in adults. Off-label, investigational uses, generalized anxiety disorder, GID, cognitive dysfunction associated with depression, dysthymia, persistent depressive disorder, postpartum depression, under investigation. Number 5. Indications. Vortioxetine is indicated for treatment of major depressive disorder, MDD, characterized by persistent sadness, loss of interest, changes in appetite, sleep disturbance, and cognitive impairment. Not indicated for pediatric use, 18 years, due to increased risk of suicidal ideation. Number 6. Contraindications. Absolute contraindications. Hypersensitivity to vortioxetine or any excipients. Concurrent use with MAO inhibitors, MAOIs, or within 14 days of discontinuing an MAOI, 21 days before starting an MAOI. Relative contraindications, cautions. Severe hepatic impairment. History of bipolar disorder, may trigger mania, hypomania. History of seizures, bleeding disorders. NESMA 7. Before taking this medicine, precautions. Discuss with your healthcare provider if you have history of bipolar disorder, mania, or psychosis, epilepsy or seizure disorders, liver or kidney impairment, low sodium, hyponatremia, or are taking diuretics, bleeding problems or are on anticoagulant, antiplatelet therapy, pregnancy or breastfeeding, safety not well established, history of suicidal thoughts or self-harm. Important precautions. Monitor for suicidal ideation, especially in young adults, 18 to 24 years. Avoid alcohol consumption. Inform doctor of all medications, vitamins, or herbal products. E. St. John's wort. Hammer 8. How to use. Take by mouth once daily at the same time each day. Can be taken with or without food. Swallow tablets whole. Do not crush or chew. Continue taking even if symptoms improve. Do not stop suddenly without consulting your doctor. Dosing information. For adults with major depressive disorder, stage, dose, note, initial dose, 10 milligrams once daily, may start at 5 milligrams for sensitive patients. Maintenance dose, 5 to 20 milligrams once daily. Adjust according to tolerance and response. Maximum dose, 20 milligrams per day. No benefit shown above this dose. Elderly or hepatic impairment, start at 5 milligrams once daily. Dose increase with caution depending on tolerability. Renal impairment, no dose adjustment generally needed. 10. Missed dose, overdose management. Missed dose, take as soon as remembered. If it's near the next scheduled dose, skip the missed one. Do not double up doses. Overdose symptoms, dizziness, nausea, vomiting, somnolence, agitation, tremor, seizures, serotonin syndrome, coma, rare. Management, supportive and symptomatic treatment. Activated charcoal may be given if within 1 hour of ingestion. Monitor cardiac and vital signs. No specific antidote. 11. When to stop or avoid taking. Avoid or discontinue if you develop serotonin syndrome. Symptoms: agitation, confusion, fever, tremors, sweating, tachycardia. Severe allergic reaction occurs. Rash, swelling, difficulty breathing. Mania or hypomania develops. Bleeding tendency increases significantly. Tapering off. Reduce dose gradually under medical supervision to prevent withdrawal effects. Dizziness, irritability, headache, sleep disturbance. 12. Side effects. Common, 5%. Nausea, most frequent. Constipation, dizziness, dry mouth, abnormal dreams, fatigue, sexual dysfunction, decreased libido, delayed ejaculation. Less common: vomiting, itching or rash, sleep disturbances, insomnia or somnolence, increased sweating. Serious: seek medical help immediately. Serotonin syndrome, confusion, fever, muscle rigidity, restlessness, suicidal thoughts or behaviors, seizures, hyponatremia, headache, confusion, weakness, severe allergic reaction anaphylaxis, abnormal bleeding, especially with NSAIDs or warfarin. Number 13, vital information and monitoring. Time to effect: partial improvement in 1 to 2 weeks. Full benefit may take 4 to 6 weeks. Monitor for worsening depression or suicidal ideation, signs of serotonin syndrome, sodium levels in elderly or diuretic users, bleeding symptoms if on anticoagulants. Cognitive benefits: may improve memory, processing speed, and executive function in depressed patients. 14. Drug interactions, type, examples, effect, risk. MAO inhibitors, phenelzine, selegiline, linezolid. Contraindicated, risk of serotonin syndrome. Other serotonergic drugs: SSRIs, SNRIs, triptans, lithium, tramadol, fentanyl, St. John's wort. Serotonin syndrome risk: CYP6 inhibitors, fluoxetine, paroxetine, quinidine, vortioxetine concentration, adjust dose. CYP inducers, rifampin, carbamazepine, phenytoin, vortioxetine levels, reduced efficacy. Anticoagulants, NSAIDs, aspirin, warfarin, ibuprofen, naproxen. Bleeding risk, alcohol. Sedation and CNS effects. Summary table: category details. Drug name: Vortioxetine. Brand name: Trintellix. Class: serotonin modulator and stimulator. Use: major depressive disorder, root, oral. Dose range: 5 to 20 milligrams daily. Half-life: 66 hours. Metabolism: hepatic, CYP2D6 primary. Elimination: renal, 59%, and fecal, 26%. Category C. Onset of action: 2 to 4 weeks. Thank you. Have a nice day.